See how many we got on.
It says 16.
Looks like I have Belinda trying to get on. I'll wait one more minute. How about that?
Okay.
All right, let's get this party started. Can everyone hear me okay?
Yes.
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 Awesome. Yep. Well, we will call this meeting to order. And as far as the, John, can you do a printout of everybody that's on here that you can see? And I just want to make sure everybody on the call, from what I've looked at, I know all of you are members. Is there anybody that is not a member of KMGMA that is on this call? All right, hearing none, we will proceed to approval of the minutes. Let me go to them. Did everybody get the minutes?
This is Jane. I'll move that the minutes be approved as written.
Thank you, Jane.
This is Chris. I'll second.
Okay, who is that? I'm sorry.
Chris Gillespie.
Awesome, Chris. Thank you. All in favor, say aye.
Aye.
All opposed? Okay. Anybody opposed? Are you still seeing my screen? Because it looks like it says my connection was interrupted.
No, we're still seeing it.
Okay, good deal. All right, so moving along, the Blue Cross Blue Shield provider meeting. Stacy, I know Shirley's, she wasn't going to be able to be on here. Stacy, you want to give us some info?
We have not had a meeting since our last insurance meeting.
And you are so right. Okay.
So no report. But
Okay.
if you have anything, bring it to us because we do have a meeting next month.
Yeah, and I think that meeting is before our conference. Yes?
Let me check the date here. Hold on. It is April 8th. Yes.
All right, very good. Okay. So we'll have more at our next meeting in Wichita on that topic then. Thanks, Stacy.
And the next one.
Legislate.
Oh, sorry. I was just going to say on the next one also, Linda, on the Aetna Better Health, we have a meeting with them on the 22nd of March. So.
Oh, good. Okay.
And you should be able to see your claims on Validity right now. You should not be having to pay to see them. They are accessible, and you can even upload information if you are trying to fix a corrected claim or submit a corrected claim.
Okay, great, thank you for that info. As far as if we move on to legislative, Carrie, are you on? Didn't think I saw her out there, but in reference to that, she did send out, or actually I think it came out from Dee, as far as the MGMA site. Hopefully all of you kind of get those notices from MGMA and what they're doing as far as the advocacy efforts, some with the No Surprise Act, others with the Medicare sequestration, that they're trying to get them to, you know, keep on suspending that. Other things out there in legislation are like prior auths, trying to get those all the same and rework some different deals on that. I know I saw one where, you know, if you're doing good on a prior auth procedure and they're being approved, it's like, okay, quit asking for prior auths on them and then look at it again in 6 months or something. It was something to that effect is what I saw. But anyway, MGMA is a good place to go out there and look at anything going on in legislation. And I know we'll get a lot more info on everything come our meeting next month in April too at conference. So
I saw there was also.
anybody have
Yeah,
to
some
add to that?
legislation. Yeah, I saw there was some legislation that was being worked on to change credit reporting so that medical charges by collection agencies wouldn't appear on a credit report. They'll move that from 6 months to 1 year and change the requirements for removing paid medical bills off of people's credit reports. There's an act going through federally right now on that.
Interesting. Good to know. I guess it just makes them not want to pay us more when it won't be on their credit report, but
Yeah, for a year.
yeah. Okay, good deal. All right, the POAG, was Tracy going to be on today? Tracy, are you there? Thinking not. I'm thinking she was out of town today, so won't do anything on that. I will say that the CAC committee that I'm on for KMGMA, I attended my first one of those. It was very interesting, and just to kind of hear what they talk about and report kind of what they were doing, that type of thing. I don't have a lot of notes from it. Some of it was just like they had people on there from Medicare talking about all the education things that are available and those type of things. But anyway, I just thought I'd report that. I had my first one, and it wasn't about anything specific on there. So does anyone else attend those?
Not me.
Okay. Right. Well, let's move on to old business. Blue Cross Blue Shield of Kansas, the portal for electronic records. I believe, it is part of QBRP, and I believe you can start signing up April 1st for it, and somebody can certainly correct me on that if I'm wrong. The reason I don't have the actual dates right here, and I can look them up, but we're one of the providers that have been doing it trying to get all the bugs worked out before everybody goes on. So that is everybody on board with that?
We haven't done anything from the portal side. We've been doing other QBRP, but we haven't done anything on the portal.
Linda,
Hmm.
this is Belinda. We're on it. We've been testing with them. It's going well.
Okay, good. Well, it is the April 1st date because I did verify that. So everybody, refer to your CAP report so you can get that incentive, because there's an incentive that goes away, and then this kind of makes up the difference for that. So everybody be sure and check on that, okay? Okay, ABH, actually, Stacy, this is what you were talking about, right? Your next meeting's on the 22nd?
Yes, that's correct.
Okay, so there's nothing new. We should still be able to see our claims and do corrections on there thus far.
Right, out on Availity.
Okay. Okay, good deal. Next on the agenda for old business is the Humana Medicare Advantage. Nothing had been resolved with this GA denying provider responsibility. Belinda, Colette, do you have any kind of update?
I don't have anything. We can't get a rep to call us back.
Are they still using the provider responsibility on the GA?
No, that's the problem. They don't tell, they say we have to write it off. That's our whole beef.
Okay, so they still are denying it incorrectly.
That's correct.
Okay. Not get a rep to call you. I'll do I'll run a report on my side and see if we're experiencing that same thing. And then I'll also look to see who and if anybody's helped us out with anything, and let the two of you know, okay?
Okay, that works.
The No Surprise Act, the next on there, we're, as far as Cotton O'Neill, we're plugging along, trying to do and abide by the rules that are out there. I know there's been, if anybody does look at MGMA, there's been a lawsuit from Texas that Texas won about a portion of it. Any other comments on the No Surprise Act?
I have a question on that, Linda. Do you know if somebody comes in for just laboratory or has lab done that day, are we required to give them an estimate of lab on the lab? Or is it because something that's scheduled 3 days in advance and primarily surgery kind of stuff?
It's primarily, it should be for all of that, but there's some kind of option out for that lab. I know for us, that piece does not affect us when they just come in for their lab, because the lab order could be out there and they come in anytime to do it.
Right,
So,
right. And our other issue is, most of our lab we send out to LabCorp, And a lot of times we don't have any idea what they're going to charge on tests that are normal routine test. So I didn't know what our obligation was on, when they come in from a specialist with an order that they need lab on some weird test, how to handle that.
Are you billing it, or, I mean, I guess LabCorp's billing it, so it's
Well,
that
it-
third
it-
party.
It kind of depends. I mean, if it's a normal like Blue Cross, that kind of thing, we bill it. If it's Medicare or Medicaid or whatever, LabCorp bills it, or we can have LabCorp bill it, but usually on the weird test, we do have LabCorp bill it, but is it our responsibility to get that estimate for them?
Well, and of course, when you have to remember, this is just for the non-insured. So it's going to be your self-pay that come in.
But is it just for the non-insured, or is it for if they're out of network? And again, how do we know if they're out of network?
Okay, well, and the out of network, I don't have all of that pulled out with me. Honestly, right now, that doesn't pertain to everything. That out of network is more in like
Okay,
an emergency room, and when you have like somebody at a hospital that might be out of network, but the hospital's in network, or vice
Okay.
versa.
okay,
Now, a big part of that is coming for where that's for everything, but it's not this year.
okay.
I'd have to refresh my memory on all of that, but yeah, I think
Okay.
before the last meeting, I sent out some info on what information we had, but yeah, you don't need to worry about that piece right now.
Okay, perfect.
Clinic.
Thank you.
Yes. Anyone else? Anything on the No Surprise Act? Do you want me to keep this on the agenda for our next meeting?
Yeah, you probably should.
Yeah, I would agree with
I
that.
would agree.
Okay. Okay, telehealth, Blue Cross Blue Shield. We talked about this last time. I'll admit, when I initially read that, when it came out, I didn't understand it the way that they meant it. So I was like, yay, Blue Cross and Blue Shield are going to pay it 100% of our fee schedule, the professional fee schedule, but that's not what they meant. They're doing the site of service. So basically, they're going to reimburse that telehealth as if it was done in a facility. That's just FYI to everyone out there. I know for us, it's a loss for us, especially according to, since COVID, when they were paying it 100% of like as in done in the office, it makes a huge difference for us. But it is better than pre-COVID, which we didn't do telemedicine pre-COVID. So anyway, just everybody should note that change in reimbursement that was effective the 1st of this year if you're doing the telehealth. Any questions on that? Okay, hearing none. Let's go on to new business. Anybody have anything?
Hi, this is Glenda again. I have a couple of questions. How's everybody handling charging for the COVID test, or so we had the free test, but we were, in the middle of COVID, we were billing for the COVID collection and insurance was paying it. And now they're denying the COVID collection as just content of service, even if there's not an office visit. Can anybody else give me any feedback on that?
Oh, Glenda, we're still billing the same way with the collection and the other. I've not seen denials on the The collection piece,
Or can you tell me, because we're even getting denied from Blue Cross on the collection piece. So I'm thinking, okay, are we supposed to be adding a modifier to it? Are we supposed to be, I don't know, because for a long time it wasn't a problem. And since the first of the year, we're getting none of them paid for.
so are you billing, what are you billing for the collection fee? We're doing the 99211 as far as I know still.
We were doing the 99000.
Oh, no.
It should be the 99211 as the nursing level. Is that correct? Because the 99211 is the nursing level visit, correct?
Who's saying that?
This is Glenda still. I mean, so we should be billing the 99211 as the nursing level, correct?
Yes, that's
Okay.
what we're doing, is the 99211. Does anybody else doing anything different?
Nope.
It's 99211, okay. And the other issue we're having is with Aetna, not Better Health, just with regular Aetna. They quit paying us on all of our dipsticks and on all of our venipunctures, and saying they're all content of service. And even our venipunctures, when they don't have an office visit, they've been saying it's content of service with the lab. And again, this has been since the first of the year too, and we've called them and called them and called them, and they're like, no, that's content of service of the lab. Well, we do the venipuncture here and we send the lab out. So how is that content of service?
I mean, I agree with you, Glenda. What insurance was it?
Aetna?
Aetna?
Uh-huh.
For one of the commercials stating that that was going to start happening. I mean, I know there's other payers that do that same thing. They consider that as part of the lab. But with that said, if all you're doing is that,
Exactly.
I
Yeah.
don't know the answer to that.
Okay. And of course, we don't have any really direct representative to talk to, so we just call in to the regular customer service and we get nowhere. So I don't know if anybody else has any contacts with Aetna they could share.
We'll look and see who our rep is. And this is the commercial. Is this the commercial
Correct.
side, Glenda?
Yes, yes, the
Okay.
commercial side.
So is everyone else experiencing that also, the content of service, venipuncture?
Yes. This is Chris.
Chris is also, okay. Well, if I find our contact name, I'll just send it out to the group.
Okay.
Because I
Then I
know
have- Go ahead.
I'm thinking that we have one that does a little bit of everything.
Right.
Anyway, I'll check into it. Okay.
And then the only other thing I wanted to ask the group is, what is everybody else doing as far as mandatory masking in their office for patients? Our patients, I guess, since everybody else is loosening up, they all think that they can come in without mask on and stuff. And we still have notes on our door that all masks are required, but I think that everybody thinks that, oh, the college isn't requiring it and the government isn't requiring it. Why are we requiring it? So I didn't know if everybody else is still requiring it in their office from patients, or what your guys' policies are right now.
We do require them. This is Chris at Salina.
Okay.
And if they don't have a mask when they walk in, they're handed one at the front desk.
And
If
that's
they
what we
don't
do.
if they don't want to put it on, they're asked to leave.
That's what we're doing right now too, is handing out masks. But, we weren't handing out hardly any mask. And like the last month, I mean, everybody that comes through the door doesn't have a mask. Oh, you guys are still requiring that? And so I'm like, maybe we're an exception. I don't know. So that's why I wanted to know what everybody else was doing.
No, we're seeing the same thing. We are handing out a lot of masks, but even my doctors are split. one of the doctors says, no, I do not want their mask when they are in my rooms, and they leave without mask, but the signs still say wear a mask.
We're still doing the mask thing too. This is Linda.
We do that, and we give an option. If they refuse, they can do their appointment by televideo.
And this is Colette, and we require the mask, and they're handed one if they don't have one. And if they don't want to, then out the door they go.
This is Belinda, same here.
Good deal. Good conversation, Glenda. You got anything else?
I think that's enough for today.
Got a quiet group today. You're all like me. I'm worn out from all of this, but it's like craziness. And I'm looking forward to being able to see people face to face next month. Everybody planning on going?
I'm excited to go.
Yeah.
Yeah, it'll be nice.
Okay, so as far as next month, would it be beneficial? Would you like me to get like our NCO reps to give updates at our meeting down there?
I think that's always beneficial.
I agree.
Okay. Because I know that there is, when is the contract up? They all have one more year, right, this year? Is that right?
Well,
Anyway,
it's coming
I
up
know-
because I got a letter from CareSource telling me that they were intending to submit a proposal for the CanCare program.
Yeah, so that would be for 2023. Because I've been hearing about, I heard that one, and I think there's another one out there too, but okay, anyway, I'll touch base with those 3 MCOs. I think, another thing, the KMAP, they're coming up with everybody is aware of like their new provider portal, whatever, it's KMMS or something. Everybody aware of that? I just thought I'd bring that up. Let me see if I can find it here.
Yes, it's KMMS.
Yeah.
Those of us that credential have been using that site for a couple years now.
Right. And then, so what's the newest thing for the rest of this going live then?
On the old KMAP expires, I believe, the 28th, and then the new one goes up 1st of like April 4th, April 2nd. No, 4/4.
Yeah, April 4th.
That's what.
Okay, this is just a manual. Okay, that has that. And you're right. I mean, our credentialing team's been using this for a while too. So good. Everybody's aware of it. That's great. I think this is going to be our shortest meeting on record, ladies, gentlemen. Right?
I think it might be.
Okay, well, one more call for anything additional.
Linda, can I ask a question?
Sure.
This is Stacy. We are getting, of course, I think everybody is getting the HEDIS audits from everybody. One of the people that are procuring records for Sunflower told my staff that we had 5 days to comply with our contract to get records, and that was 5 days, not 5 working days. Because she came and asked me this morning that, and I said, no, I know nothing about that. Has anyone else heard that?
No.
Stacy, I just got one and I didn't look at the fax cover sheet. I'll run and get it real quick.
Yeah, because we got our fax today and they want them by the 8th. And when they called, they told her that she had 5 days to comply, and those were 5 days, not business days.
That's craziness. I have not seen that, Stacy.
Well, that's what I thought too, but
Let's see, in our fax.
it's up at the top, I believe.
Okay, okay, here we go. Nope, it does. It says, please review and respond to the request that accompanies this reminder within the next 5 days. If you cannot meet the 5-day extension timeline, please call us to coordinate a new date or an alternate retrieval method. So no, it's on there.
Okay. Well, I didn't think that was in our contracts whatsoever, but I just wanted to make sure that, because I told her to forward the call to me next time.
I'm glad you said that. Yeah, we got it today. Holy cow. That'd be the pits if you had more than one patient.
Oh, ours is pages of patients, and yeah.
Well, the one I got today had one, but that doesn't mean, whew.
And also notice your sterilization consents on KMAP. The end date is 4/22, but there has been no indication that there's a new form coming out.
Well, I guess they're gonna have to send that out before. Anyway, I thought I saw something on that, but okay. I was pulling up the chat here. It looks like somebody responded. Oh, it's Judy. So Judy's wondering has anybody been doing the revalidation with KMAP? She's been trying to do it and can't get past the first page. KMAP is aware and told me that it's not an issue, that I hadn't done it by March 1st. Question, are you a Medicare provider? Defaults to no, and it should be yes. But when changed to yes, that creates issues. Then it asks about MCOs, and you have to answer that question. But when you do, it keeps you from going any further. Is anybody else having that problem? Judy, I have not heard that from our area that does that. When they're telling you that it's not an issue, are you able to unmute and talk? Can you guys still hear me?
Yes.
Yep.
I haven't had any revalidations to do. But I wonder if it has
Okay.
something to do with her web browser, if that's part of it.
See if I could expand this. So Judy, are you hearing us? Well, yes, if anybody, we can't hear you, Judy, no. We need to unmute her or something, maybe, John?
Yeah, I'm looking at the list. Okay. Try it now, Judy. Says she's not muted.
She's not muted. Can you talk, are you talking to us, Judy?
Not hearing anything.
Yeah, we can't hear you. Well, I mean, if they said it's not an issue, I mean, I definitely make sure you keep good documentation on that in case they come back and tell you it is an issue. But I've not heard on that. I've not heard about anything like that on my side. So just if you can let us know if you find out more, that'd be great, Judy. Thank you. Okay, group. Well, April 20th at 6:30 is what it didn't matter what browser, they couldn't even get it to work right at KMAP. Aha. Okay. Well, if they can't get it to work right at KMAP, it's probably an issue for everyone then that has to do it. Good to know.
Hey, Linda,
Yes.
this is Belinda.
Yeah.
I just want to tell everybody this is my last day at the clinic. I'll be officially retired, and I'll miss all you guys.
Oh, yahoo, Belinda. I saw that somewhere. I am so happy you're able to retire.
Well,
Congratulations.
it's pretty bittersweet. I don't, it's hard to leave after you've been here for a long time.
Aw.
But, you know, it's time. And Julie Schott is taking my place, and she's very good, and I think you'll all like her. And she's done a great job. We've been training for 2 months, but was a good student.
I think you still
Very
need to
good.
come to the meetings, Belinda. I'll bring you a Diet Coke.
Would you?
Of course, always.
And I thank you for those. They're lifesavers.
Of course.
What was Julie's last name, Belinda?
It's Schott, S-C-H-O-T-T. And she's S-C-H-O-T-T.
Okay, good deal.
Okay, and she's
Well,
she joined,
Are you
but
gonna
I don't think it's official yet.
Okay. Were you planning on coming to the meeting? Evidently not.
No, I wasn't. I guess I wouldn't feel right doing that. I'm tempted though, just to see everybody.
Well, good luck to you, Belinda. You've been a very helpful over all the past years. We'll miss you.
No, I'll miss you guys. I mean, if I miss you too much, I'll show up for a lunch or something at the meeting.
That sounds good.
Yeah, might be a good way to decompress a little bit, one thing at a time.
Good deal. Okay, anyone else have any news? Going once? Going twice? Hearing none, we'll call the meeting to an end. It was a good talking to all of you, and so looking forward to seeing you all in April. Thank you.
Right, see you at the meeting.
Goodbye.
Goodbye.
Bye.
Bye.